Now, this video touches on a lot of different things about complex hernia care. You can tell so much about somebody just by looking at them, hearing their story. So we don't have a CT scan to look at here, but we can tell just by looking at this patient that has a pretty wide, pretty large abdominal wall hernia. The kind of hernia that honestly a lot of surgeons would shy away from fixing because it's going to be hard and it's going to be complex. Now, we don't know, has he had previous repairs? I can tell you with some degree of certainty he's had previous abdominal surgery of some kind. Number one, because you don't just get hernias like this from out of thin air. You have to have a surgery before with an incision. It weakens your tendons, weakens your muscle. In general, anytime we make an incision through anything, muscle, tendon, skin, it only ever heals at like 85% of the maximum tensile strength that it was before. So having an incision, the longer the incision is, the higher chance of getting a hernia afterwards. And so we know that he's basically had a surgery of some sort from that, and because you can see the scar, it's in the middle. You can see how wide that hernia is from edge to edge, where that bulge happens. That's where you need to take those abdominal rectus muscles and close everything back up, okay? So it's a pretty complex repair. Almost certainly is gonna need some sort of component separation of some sort to bring things back together. Next thing we notice is that this gentleman references picking something heavy up and then noticing that the hernia popped up like that. Is this how some of these start? Sure. Most of the time, it's more of a slower, insidious onset to these things where it's something a little small that gets slowly larger over time until it reaches a critical size, and it usually stops, right? And a lot of people blame themselves, like this hernia happened because I picked this thing up, that thing up. In general, it was going to happen either way, either weakening from previous surgery, genetic weakening, weight gain. So a lot of people like blame themselves for doing whatever activity made their hernia happen, but in general, it was probably just the straw that broke the camel's back, and it was going to happen eventually. So I think there's a lot of like hernia guilt about something they did wrong, and they should stop feeling like that because it was going to happen regardless. The biggest thing you have to look out for if you have a hernia of this type are signs of obstruction, meaning if some intestine gets in that hernia and twists around, you can get a blockage, you're throwing up, you're bloated, you can't have a bowel movement, can't pass gas, you feel awful, you go to the ER. Needing an emergency surgery for a bowel obstruction with hernias like this is the worst case scenario, and that's what we want to prevent as hernia surgeons. We want to fix this before it becomes an emergency, but a lot of this is optimization, right? BMI, not smoking, diabetes under control. Do one good job at this and fix it and be done with it forever. I reached out to this gentleman to see if there's anything he'd like to talk about, and talk about his hernia, his care moving forward, see what surgeries he's had, see if we can help him in any way. This is certainly a fixable problem, and no one should have to live in pain and fear like this.